Dr. Marketing Tips, paging Dr. Marketing Tips. Dr. Marketing Tips, you're needed in the marketing department.
Welcome to the Dr. Marketing Tips Podcast, your prescription to the answers you seek to grow your medical practice easier, better, and faster. This show is all about connecting practice administrators and medical marketing professionals with peers working in practices, learning from experiences, making mistakes, and sharing successes. Let's get started.
Hello and welcome to the Dr. Marketing Tips Podcast. I'm Corey, one of your hosts, and with me today is Dr. Mike Greiwe, an orthopedic surgeon with OrthoCincy Orthopaedics in sports medicine. By day, Dr. Greiwe specializes in shoulder and elbow surgery and sports medicine at offices in Ohio and Kentucky. And by night, he's a tech entrepreneur and founder of the OrthoLive and SpringHealthLive telemedicine platforms. So Doc, thanks for joining us today.
Absolutely, Corey. Thank you very much for having me. Glad to be here.
Awesome. So in this episode, we're going to explore what's working from a marketing perspective for Dr. Greiwe in his practice, and then talk a little bit about how the telemedicine industry has exploded recently and what the long-term implications of that growth for practices really is. So with all that said, Dr. Greiwe, as we just established, you are a surgeon with OrthoCincy. So can you tell us a bit about how they're marketing their practice as a whole in your practice specifically?
Yeah, absolutely. So we have a marketing team that we work with, and a lot of it is web-based marketing. So right now we have a bunch of different digital marketing campaigns. We use our website and we work through the website, and we also have kind of an outreach program where we go out to local primary care doctors' offices, and we have lunches and things like that. So they do a lot of work on the digital and sort of in-person campaigns within our local community. We also use radio and we use television as well as two other kind of marketing avenues. And so they do a nice job. And specific to the doctors, we highlight certain physicians. We have kind of an Ortho Connect newsletter that goes out as well, so our patients kind of read about us. And then we even do some videos that we kind of explain and educate our patients, and those play inside our waiting room so that we can better educate patients. And I think it also kind of ties in the marketing piece there. So we do quite a lot, but we're always trying to find like the best and newest way of marketing in our community. So.
Yeah, something that a lot of our clients and our listeners are always interested in is that video component. Now, do you guys do any of the video capturing yourself, or do you have a team that comes in to do that?
Yeah, we usually have a team that comes in. So, we have a particular website team that we were working with, and that team came in with sort of video cameras, and then, we would take like a model. So for me, like a shoulder model, we would I'd hold the shoulder model and kind of explain, what arthritis was or what, a rotator cuff tear was. And I think that's really helpful for patients as they get a feel for, the problem that's going on. And then we post those on YouTube, and we, also kind of use that in some of our commercials and things like that. So that's kind of how we've done it. Have you guys seen something similar? You guys do the same thing?
Yeah, we've seen a lot of success with kind of repurposing that content. So what we'll do, same thing where you have the one video and then you can post that on YouTube, use it in your social media channels, websites, specific patient outreach, those kinds of things. So there's a way to take that video and let's say, it's just a 30-second clip of an introduction to you, but you can use it in multiple different places. Something else that we actually see, and I don't know if you guys have done this yet, but we work with an orthopedic group where one of the docs will do a lot of like selfie style videos. So he'll just grab his iPhone and kind of hold it up and sort of walk people through like a day in the life of a surgeon, which is something that did fantastic on social media.
Oh, that's great. That's a really cool idea. I've seen one of those with a children's doctor, and it was really neat. I mean, it was a great video, and it just sort of was off the cuff. And I think that resonates with people sort of trying to understand their doctor a little bit better. So that's great.
Exactly. There's power in that because it's authentic. It's not like overly produced. And right. So you mentioned that you work with a team of external marketing specialists. Do you have somebody internally at OrthoCincy as well?
We do. We have a head of marketing, and then we have two other people that report to our head of marketing. And so that's kind of our core team is like 3 people, that do a lot of our marketing and outreach. So that's how it works internally.
So a lot of our listeners, they're physicians or they're practice admins or they're marketing folks within practices, like what we were just talking about. And we find that a lot of physicians like to be really hands-on, and then some, as I'm sure you're aware, probably want nothing to do with marketing. So,
Right.
I mean, has that been your experience as well? And how do you sort of get everybody on the same page there?
Yeah, absolutely. I think that's one of the challenges inside a big practice is that you have some people that are gung-ho, on the marketing front. They want to be involved and they want to be doing a lot of the outreach. And then you have some physicians that, maybe they have a really established practice. They don't feel the need to get involved in marketing. And so they don't participate. So what we do is we have a core marketing committee, and that marketing committee is head up by obviously our, head of marketing. And then we have a physician that serves on the committee, and we actually have 3 physicians that serve on our marketing committee. And we may be down to 2 right now, but everybody attends these meetings. They're usually once a month. And then we kind of go through all of the, different items that we need to get through, signage, ads, all the different things. But I think it helps because then that reports back to our board, and that committee makes recommendations. And so even if, someone is not interested in marketing, they still get sort of the recommendations of the marketing committee through the board, and then we can make decisions. So that's kind of how we've done in our practice. But it is sort of hard to get everybody, on board. And, what we say at OrthoCincy is, listen, if you weren't at the meeting, then, your voice doesn't get heard. So, come to the meeting if you want to have a say. So
Yeah, that makes sense.
Yeah.
What has been one of the biggest challenges of marketing the practice? Because like you said, there are so many personalities and goals and I mean, just as a quick example and an aside, one thing that sometimes we have to deal with some of the clients we work with is if someone is really gung-ho about something, they're going to say, well, screw it, I'm going to go do it anyway. I'll spend my own money and then, screw you guys kind of thing. So do you ever encounter something like that, or is there another challenge that you face?
Yeah, I mean, that happens all the time because, you have a bunch of, it's sort of like having, if you have a group of 20 people and they're all partners, it's like having 20, bosses. And so everybody has their own ideas and thoughts. And, we don't really allow for, people to do kind of their own thing very much from a marketing perspective. We really believe in the brand of OrthoCincy. And so we tend to restrict people from doing a lot of stuff on their own. But if they really feel strongly about a cause or something, then we will of course let them sponsor an event or things like that. But to market their own practice, we don't really allow them to do that so much. So, if I was a shoulder specialist and I just start marketing, as Cincinnati shoulder and elbow, even though I'm a part of OrthoCincy, that wouldn't fly in our practice. So we kind of, we do run into that challenge. But one of the other challenges I was thinking of is just kind of, in orthopedics specifically, you have 10 different specialties. And, the sports guys, there's very competitive in our area. So sports becomes sort of the focus of marketing. And so you lose a lot of the marketing for the other areas arthroplasty, hip and knee replacement. That's what arthroplasty is. Or foot and ankle surgery. Those areas get sort of glossed over because sports is so competitive in our area. And so, we spend a lot of sports marketing dollars, but we don't spend a lot of dollars for the foot and ankle specialists. So it's hard to kind of distribute everything, but the competition in the environment, I think, dictates a lot, where we go. But I think that's one of the hardest things about running an orthopedic practice. You got a lot of different specialties. You've got to make sure you cover everything with the marketing and make sure that everybody's kind of getting their fair share.
Yeah, that's a great point. And that's something that we have to deal with as well, because like you said, it can be so varied that you have to sort of make sure that love is spread around, right? And there's enough budget to go around for everybody. Let's rewind the clock a little bit. When you were just starting out, how did you personally build your practice? And what I mean by that is, did you go out and sort of do the door-to-door referral marketing, or did you rely on someone on the marketing team, or kind of walk us through that?
Yeah, when I first started, which was back a long time ago in 2010 now, it's amazing how quickly time passes. But
Yeah.
when I first started, I worked with a person from the company. We didn't have a marketing specialist at that point in time, but I worked with someone from the company to get out and visit the different primary care doctors' offices and meet everyone. And I did that for probably about 6 to 9 months, just kind of like making sure that I was there around lunches and introducing myself, and also worked hard at like doing the same thing inside the hospital. But that was kind of the main thing that I did. There was not like anything else really. It was more just getting to know the referral base a little bit more, and letting them know that, you know, these are the things that I did, and I was adding something new to the area. And that was kind of I think the thing that helped me the most is that, you know, there really wasn't that many people doing what I was doing in the Northern Kentucky, you know, Cincinnati area. So it helped me to grow a practice, you know, but I think marketing is critical in that first, you know, startup period. And I've got a partner, a shoulder and elbow partner, that's going to be starting with us soon. And so we really want to get him going and make sure that, you know, he gets ramped up, and marketing is going to be critical for him.
Yeah, absolutely. And I was going to ask, actually, for someone that is just about to start their practice, or they know they're going to be starting at the end of the summer or what have you, do you have any tips for them and what they could be doing?
Yeah, I was just talking about this last week, actually, with this particular gentleman. And so it was, you know, I said, listen, you know, we should have sort of a website where people can go to learn about, you know, what it is that you're doing. So we highlight you on the website. We make sure that everybody knows about you, your family, because, you know, what patients are really interested in is, yeah, do you have the qualifications? Okay, that's all well and good. But really, like, who are you as a person? And the more that they get to know you as a person, the more comfortable they feel in being in your office and possibly even having surgery with you. And, you know, being a physician is really a personal thing. And so it's important for patients to understand like who you are as a person, so that they can connect with you. And if they feel that connection, then I think you've gone a long way. If they haven't even visited your office yet and you've already sort of formed a slight bond with them, that I think starts to endear them to you a little bit. And then you do a good work for them and you make them better, then they tell their friends, and they may even share something about you personally, which I think people like. So I think it's really important to get the word out, not only to the referral base, but also just to your patients in sort of a digital way. You know, who you are, you know, where you came from, you know, things about your family, things you enjoy to do. And I think that's important.
Yeah, absolutely. It's funny you say that, because we kind of say the same thing at our office, where we say when the patients are looking, they are going to assume you went to a great school and that you were top of the class and that, you know what you're doing. And some of the times what can differentiate you is your online reviews, and then if they can connect with you. And just the other week, actually, I was talking to a foot and ankle surgeon, and he was telling me, he's like, you know, that damn video that you guys made me do where I had to talk about my family and my hobbies, people still come up to me and tell me something about that video like every week.
Oh, yeah.
Yeah. So it's just, you know, it's validating.
100%. I think, you know, your patients want to know you, you know,
Yeah.
they want, you know, they want to be your friend, and also like, you know, they want to trust you. And the things that we can do to build trust through marketing is really, I think, important, especially in the medical field.
Hey guys, Corey here, co-host of the Dr. Marketing Tips podcast, and I wanted to interrupt this episode just for a minute to tell you about Insight Training Solutions. So Insight Training Solutions is an ongoing employee engagement and training platform for your medical practice, meaning employees can log on and take these medical practice specific trainings whenever and wherever they are. And each training is meant to increase employee engagement, improve practice reputation, and develop some patient service mindsets. If we're being honest, something that we all know some of the employees may lack. Not calling anybody out by name, but one of the cool things about Insight Training Solutions is they're always developing new content, and they just released 10 steps to a phenomenal patient experience, where you'll learn how to create a phenomenal patient experience, strengthen job security, and discover customer service secrets for your entire team. So this course is in addition to the other ones they already have, which include communication across generations and how to understand today's multi-generational workforce and how to develop overall patient experience. This is another course, the new approach to customer service. We've also got 8 ways to wow patients, and you can sign up for a free trial to see what everything is about at insighttrainingsolutions.io. That's insighttrainingsolutions.io, or just Google Insight Training Solutions. You'll be glad you did.
So as we talked about earlier, you're a full-time surgeon during the day and sort of a tech entrepreneur by night. So tell us a little bit about OrthoLive, SpringHealthLive, and why you started those companies.
Yeah, thanks, Corey. I mean, I think the impetus to start OrthoLive and SpringHealthLive was really to try to help my patients. And the thing I was seeing in my practice was that patients were coming to see me from a long way away, and I wanted to be able to treat them a little bit easier and not have to have them drive for 4 hours to talk about, something maybe that was relatively basic. I really liked having the first visit in person, but the follow-up visits a lot of times, especially after surgery, I felt bad for them that they'd have to drive so long and then wait for me. And then, it ended up being a full day for a lot of my patients. And so telemedicine became kind of a interest of mine. And I also thought that telemedicine had a way of changing the healthcare landscape in a positive way, decreasing cost and improving our ability to control healthcare dollars. And so for all those reasons, I felt like it was a great solution. I started to look around to try to see if there was a good solution for surgeons out there. And I just never could find the system that was, the best system for me personally. So, and that was in 2016. So, and it was really early 2016. I was looking, and I ended up getting hooked up with someone who was the CEO of a large video company called VC. And he encouraged me because of the opportunity to grow inside the orthopedic space to form OrthoLive. And so I did that in late 2016. And it's been a great ride so far, and we're having a lot of fun. So, but yeah, that's the story of kind of like how things got started.
Yeah, and we all know now because of what's going on with COVID and the pandemic that the use of telemedicine has exploded. So I would imagine that for OrthoLive and SpringHealthLive, you guys have seen a lot of growth pretty recently as well, right?
Yeah, it was a massive growth time, and we had been sort of working hard for about 3 years and growing. But when March hit, we grew 1,000% in about 2 weeks. And so it was an explosion of interest in telemedicine. One, because it was helping to keep people safe. Two, it was helping to keep the lights on in practices. They couldn't really get anyone to come in, obviously because of the rules and things that were occurring. And so it was sort of a lifeline for those practices. And telemedicine was here to stay, and it's not so bad. It actually is helpful from an efficiency standpoint. And so there were a lot of like great benefits that came out of the crisis. And as terrible as it was, I think it did help to spark telemedicine across the country.
Yeah, and it seemed like in the past, patients kind of knew about it, but there was sort of a barrier to entry. And I don't know if that was cost or availability or regulation or what have you, but what do you kind of see, on the horizon now that some of those barriers have been removed?
Yeah, I think there's going to be more trust with, online physicians and people that are working through, video platforms. So I think there was initially, like in the last 5 years, there's certainly been a growth of telemedicine. If you look at the charts, we had maybe 15 million telemedicine visits in 2018, and it's going to be above 50 million this year, probably above, 100 million. So what I'm expecting to see is a lot of people that are more responsive to speaking with a physician, using telemedicine. And so I think that's the main thing that's going to come from this, is more of a trust of, someone that has credentials on the other line to be able to help them. And so I think that's the main thing that I see.
What would you say to a provider that says, that sounds great, most of my patients are a little bit older, they can barely work a flip phone or CC on somebody on an email. How does telemedicine work for them?
I mean, I've been shocked. The thing is that for me, like, I have seen, 80-year-old patients get right on this thing with no problems, and just are happy to be chatting and don't appear to have any technical difficulties at all. So I know there's that subsection of the population that is like totally tech savvy, and then you have others that may struggle a little bit. But like choosing a platform, I think, that has the right infrastructure, like support team, and also an easy entry for patients is really, I think, very critical as people choose a platform to use. So I used to say that, like, older patients weren't, particularly well suited for telemedicine, but I have to say that the crisis has really changed my opinion of that. I realize now that there's a lot of older patients that are just fine with telemedicine. They do very well. So I think you let the patient tell you whether or not they're capable. And that's really the rule I'm following now.
Yeah, that's a great point. It's something that we've been talking about a lot on this show is patient readiness. So kind of getting patients educated for what's going to happen during a telemedicine visit. So if they sign up for this, that's one piece of it. But then two, they actually have to connect and go through with the visit. So some of the marketing that we've been doing for clients and the information that we've been sharing, things like that, is just how to properly educate the patient before the visit so they kind of know what's going to happen. And so do you have any tips for preparing patients for a telemedicine appointment?
Yeah, absolutely. Like, I think the main thing is, knowing what type of platform you're going to be using for your visit. So is it app-based? Is it web-based? Can you do both? Number two, do you have to sign in? Is there a history that needs to be taken? All those things I think are important, kind of preparing for what the visit's going to look like. And then making sure that you have good Wi-Fi connection. That's critical. And then making sure that you are, using a device that's working properly. Check your audio, check your video, make sure everything's working. And as long as those things are good, then you should have a pretty simple, easy video call without any problems.
Awesome. Yeah, those are really good tips. So just to touch on last piece on telemedicine here. So you're a full-time surgeon, full-time family man, and for some reason you decided to take on a full-time business as well. So what are some of the biggest challenges you've faced, and how have you overcome them? And then also, how do you have time to do all that stuff?
Yeah, people ask me that all the time. I think I get a lot of people who feel like I'm like, off the deep end with all the things that I've done and like to do. But, for me, it's all about time management, and probably the biggest thing is persistence. And when you believe like strongly in something and you feel like this is something that's going to help people, and you have your why, then and you just continue to work hard to make it happen, then, in general, you can be successful. I think for a lot of people, you hear the story of, inventors that have sort of like worked, at like Thomas Edison, for instance. I think he made like 1,000 light bulbs, right? That didn't work. And then like on 1,001, it worked well. So for anything in life, it's just about persistence. It's about time management, and just, continue to follow your dreams. And that's kind of like the life I've tried to lead, is just, set a target and go for it. And then, try to make sure that you, lead your team. You let other people do the very best work that they can do. I just sort of oversee a lot of things and make sure that my teammates are really great teammates. And, I think that's critical too. If you decide to start on a project, you're not just starting alone, you're starting with a bunch of people who are, going to help you. And so I've had a lot of great people that have helped me along the way.
And I would imagine too that the telemedicine piece actually probably plays into some of like the time management, right? Because if you're doing telemedicine, do you wind up with more time?
Yeah, that's, for me, it's been one of the amazing things that I first started noticing when I started doing telemedicine in 2017. I actually added more time into my day. and I was able to kind of see, a few more patients. It allowed me to kind of get done a little bit earlier on certain days. And so there was this efficiency that I hadn't had before, which was really cool. And I think if you do it right, you can have major efficiencies. Like you can start seeing patients on your operative day. You can see patients, during parts of your day that you normally wouldn't be able to. And it really does create significant efficiencies. Post-operatively, I think, patients, that's perfect for telemedicine. So there's major efficiencies you can drive. And I think one of the keys that I keep hearing from physicians with telemedicine is that there's a burnout factor that happens with physicians. And it's no joke. And I think people need more time. And this is a way to kind of get more time out of your day and allow you to kind of, just be more efficient. And that's really what we're, I think, geared to try to do as physicians. So it's helpful.
And I would venture to say too, that in addition to the efficiencies, there's probably like a revenue component, right? Where like, if you, all of a sudden, I mean, I would imagine that you would not have as many no-shows on telemedicine as you would for in-office visits. Is that right? Yeah,
no question. I think the in-office no-show rate is somewhere around like 15%. And with telemedicine, and that's a huge number. And each of those visits, from what I understand from some research, is worth about $200, to the practice. And then you end up having like the, issues with telemedicine. You end up not having those patients like miss out on those visits. And I think the average no-show rate for telemedicine is somewhere around like the 5 to 7% range. And there's some studies that show that, which is cool. So that's one piece. But then if you're driving efficiencies in your office, you're probably able to see some more patients also. So one of the things I looked at in my data was in 2017, I added like about 2 new patients per week, which doesn't seem like a lot, but that's 100 new patients a year. And you give the idea that one new patient to your practice might be worth X amount, and for orthopedic surgeons, it's about $1,100 to $1,200, somewhere in that range is kind of the average. So from a business perspective, you can really drive significant revenue with telemedicine and the efficiencies that it gets you. So there's definitely some major advantages on the patient side and the physician side. And, both parties really like it. And that's why I think it's going to be something that people use in the future.
Yeah, and you mentioned using it for post-op care recently. And I saw a stat from Healthcare IT News that said that 52% of adult patients are open to post-surgical telemedicine visits. And just anecdotally, my dad had shoulder surgery a couple weeks ago down in Florida. And the only thing he complained about was having to go back to the office because he had to take off work. He had to drive there, and it wound up taking, a little over an hour and a half of his day for a couple of weeks.
Right. I think that is a key part of, driving that efficiency and helping patients. From a patient convenience standpoint, there's nothing more miserable than having a surgery, being in a ton of pain, and having to get up, off the couch and go and drive in a bumpy car, to the doctor's office. And then, you're literally there for maybe a total of about 5 minutes while they're just checking your incisions and removing sutures, especially if it's an arthroscopic procedure. So, and they don't usually even take x-rays in that case. So there's so many times where being able to do the post-operative visits, it's a great way of utilizing telemedicine and driving efficiency and, allowing for convenience, patient convenience, and patients really appreciate it, I think.
So if someone was on the fence about telemedicine, or they signed up for it as part of like the pandemic response, and then they're saying, yeah, but that's not something that's like long-term on our roadmap, let's get rid of it. What would you kind of say to them?
Well, if it's, a physician saying that, I tell them that, first of all, the data is overwhelming that telemedicine's here to stay. And there's no ifs, ands, or buts about it. It is going to be here. Patients are going to enjoy it, and they're going to take the easiest route for care. So if they can get a telemedicine visit done in their community before they go and, wait in an office for an hour, they're going to take the telemedicine visit. So as a part of, physician survival going forward, you're going to be, going the way of Blockbuster if you're not, on the telemedicine train, at least a little bit. So, you don't have to see, a bunch of patients via telemedicine. Telemedicine doesn't have to be your thing. And it really, it's not kind of the message I've been preaching for a long time. Even if you do 5% of your visits via telemedicine, you're at least able to say, I do telemedicine and, I'm helping out a certain number of my patients. Maybe it's 10 to 15%. Maybe it's a large percentage of your practice. But telemedicine is something that I think is going to be utilized, nationwide, on into the future. And I think it's going to be something that patients come to expect and they want. And not all cases are they going to need that, but it's certainly a convenience factor that if you don't offer it, you're missing out. And ultimately, you're going to miss out on patients that would otherwise have come to you.
Yeah, absolutely. That's a great point. So last question for you. This is probably the hardest one of the day. If you could offer one tip or a takeaway for listeners when it comes to marketing their practice or for telemedicine, what would that be?
From a marketing perspective, I think, and this goes to like the practice administrators and it goes to the physicians out there. I think patients want to hear from your practice. And one of the ways that I think is important to be able to do that is to do that through some type of digital marketing, whether that's, Facebook or through Google ads or, maybe through an app that you guys, have your patients download. Every large institution right now, including most physician offices, are trying to push digital marketing. And some of our, you could take a page from like restaurant chains. You got, Chick-fil-A's got an app, Chipotle's got an app, and, you can have an app too. And that lives on that patient's phone. And then you can sort of market to them. So I think, changing the way that we do marketing and we do digital marketing is going to be important for practices. I think it's a great way of sort of taking it to the next level, is being able to digitally market through apps that you have that you're driving from a practice perspective. So, and you can also communicate with patients using that same app. So I think that's an important thing to realize that is on the horizon. It's probably going to be the next thing from a marketing perspective for practices. So.
Yeah, it's not like people are getting rid of smartphones, right? So.
Yeah, they're here to stay.
Right.
Exactly. Yeah, I think the stat is like 90% of people have a smartphone or something now. So
yes, I think I saw that recently too. And I'd venture to say in another 10 years, it's probably going to be like 97, 98%. It's going to be, pretty much.
Yeah, that's exactly right. So I think that going that direction and trying to get to people where they spend their time, which is on their phone, is really smart. And whether that's through Facebook, Google ads, or, your own digital marketing through an app, I think that's probably the best thing to do.
Yeah, absolutely. Good stuff. Okay, so we're just about out of time for today's episode. So, Doc, if our listeners want to connect with you or find more out about OrthoLive or SpringHealthLive, how can they do that?
Well, probably the best way is through our websites. It's www.ortholive.com and www.springhealthlive.com.
Awesome. Well, thanks again for joining us today. I speak for everyone listening when I say we learned a lot, and we really appreciate your time.
Absolutely, Corey. Thanks for having me.
All right, so that'll do it for now. Thanks for listening to this episode of the Dr. Marketing Tips podcast, and we'll catch you in the next one.
Thanks for listening to the DrMarketingTips.com podcast. If there's anything from today's show you want to learn more about, check out DrMarketingTips.com for our podcast resource center with all the notes, links, and goodies we mentioned during the show. If you're not already a subscriber to our show, please consider pressing the subscribe button on your podcast player so you never miss one of our future episodes. And if you haven't given us a rating or review yet on iTunes, please find a spare minute and help us reach and educate even more of our medical practice peers. Thanks again for listening, and we'll catch you next time. Doctor's orders.